But okay, I guess we can get started. Thank you all for joining. My name is Young, and I'm one of the leads for the professional development program at Rokpa, or the sector. It's a new part of Rokpa. And so today we're going to be kickstarting our career chat series, which has the aim of providing Tibetan high schoolers, college students, or really anyone who's interested with the opportunity to speak to a seasoned professional in a variety of industries. So today we have Dr. Lodoe Sangmo. You can call her Yiga, who will be our healthcare/medicine professional. And so hopefully you can take this opportunity to learn more about the journey, challenges, and rewards of the healthcare industry. And so before Yiga introduces herself, I'm going to give a brief rundown of the agenda we have planned for today. We're going to start off with a structured Q&A, and then after that, we're going to open it up to the audience members if they have any questions, and hopefully you do, because this is a very exciting opportunity. And so without further ado, I'm going to pass the mic off to Yiga, who will introduce herself.
Sure. Hi, everyone. My name is Lodoe Sangmo. You can call me Yiga. I'm currently a third-year internal medicine resident at Mount Sinai Hospital, located in New York City. And just a little bit of background about me. So I was born and raised in Kurseong, India, which is a small town near Darjeeling. My family and I moved to the US when I was 10. Since then, I've attended like public schools in New York City, so probably similar experiences to many people who are part of Rokpa. Then I went on to go to Cornell, where I studied human biology, health, and society. After that, I took a little bit of a break between medical school and college, and I did teach for America. I worked as a fifth grade special education teacher, went on to complete my medical school at the Icahn School of Medicine at Mount Sinai, which is located in the Upper East Side of New York City. And I'm currently an internal medicine resident, almost at the finish line. I'm a third year, so I'll be graduating in end of June of this year. And after that, I'm going to be working as a hospitalist at Weill Cornell, after which I am planning on applying to fellowship in gastroenterology. So yeah, I think it's a good opportunity. It's a pretty informal conversation. So if anyone has any questions about healthcare, applying to medical school, I'm happy to be a resource.
Thank you, Yiga, for that wonderful introduction. So I guess from here we can start off with our structured Q&A. And so the first section will be just a general questions. And so the first question that we have is, what initially drew you to pursue a career in medicine or healthcare?
Yeah, that's a good point. I think a lot of times when people ask this question, they expect a very profound response about why you want to be a doctor and why you want to be in healthcare. I think my interest first started just from attending math and science high school. I was surrounded by people who wanted to pursue math and science as a career, and I had an inkling, even though I was interested also in the humanities and interested in social studies and possibly journalism. Initially I had thought that maybe math and science would lead to a more stable career path, if I'm being perfectly honest. So I decided to apply to Cornell. And when I applied initially to college, I had to pick a major. And it was almost a little bit of a whim that I ended up picking human biology, health, and society. And while I was at college, I really, really enjoyed my science courses. Saw a few different career paths stemming from that, career path in research, and in doing more of the bench work of science and doing more clinical work versus a career, just having the opportunity to interact with patients. And I felt like being a doctor kind of combined those two paths in that, I was able to explore my interest in science and stay up to date on, just learning and reading about, different diseases and different disease presentations and just the most up-to-date research, as well as the more humanistic side of just being able to interact with patients and, being their doctor. And I think that was really solidified when I did some shadowing work. I had the opportunity when I was in college to shadow some other physicians, especially in particular, I remember this one pediatric neurologist I shadowed. who was working at Mount Sinai. And he had patients come in who he'd seen them since they were kids all the way up to 18, had incredible relationships with them, and just had this like deep, profound trust that I thought was really special. And I think just being able to be their doctor, like someone places so much trust on you and trust to kind of guide them through situations that are very tenuous or very difficult. So I really enjoyed that. And I think just being a physician allows you to kind of explore both sides of both science as well as humanism. So I thought that it was a good combination.
Thank you for that answer. And by the way, audience members, feel free to drop the questions in the chat if you have any at any point throughout this discussion. So our next question kind of touches on what you mentioned in your previous answer. So on that same note, what are the most rewarding aspects of being a resident physician?
Yeah, I mean, I think it's a really, really rewarding experience. I think even medical school like doesn't really quite prepare you for residency. Like my first rotation was actually like working in the medical ICU, where I took care of patients who were, obviously very, very incredibly sick. And I think there's so many rewarding components. I think the most rewarding part is just like talking to your patients, like getting to know them as people, and kind of bridging that with the kind of care that you're providing them. And I think there are definitely times it can be challenging. You're working very long hours. It's easy to feel like burned out, because you're surrounded by like a lot of like human suffering at times, and you're working very long hours. But I think just grounding yourself in terms of seeing each patient as their own individual person, kind of thinking back to like if this were your family member, how would you want them to be treated, and grounding yourself in that kind of mindset has been really valuable. And I think it's been incredible. I think in particular, I'm interested in going into gastroenterology. And one of the experiences I've really enjoyed in residency is working as part of like the liver transplant medicine service. And Mount Sinai is actually one of the biggest like transplant centers in the country and in New York. And we get patients who are kind of at the end of life. And if they don't get the transplant, the mortality rate within the next like 3 to 6 months is incredibly high. So just being the frontline provider, being the physician who's there to guide them through the transplant process, through transplant evaluation, and also being kind of a humanistic and understanding person who can explain it to them in a way that they can understand everything, I think is really valuable. In particular, while at Mount Sinai, I've also had the opportunity to work at Amherst Hospital, which is in Jackson Heights. And I think, oftentimes, sometimes you might encounter patients who don't necessarily have access to healthcare in the same way that people from like higher socioeconomic backgrounds do. So being someone who, is doing right by the patient, knowing that they don't necessarily have the access or like the resources they need to sort of like advocate for themselves, and being an advocate for the patient, I think is really powerful. So I think those are some of the components that have been really meaningful.
Okay, thank you. So I guess now we can shift gears and talk a little bit more about your day-to-day life as a resident. And so the next question will be, can you walk us through your typical day? I know that it varies,
Yeah, I
but
think,
if you could give a general
yeah. So I think kind of
breakdown.
one of the fun things about being a resident is that my schedule changes every 2 weeks. People who like a little bit more stability might find that not as fun. But for example, right now I'm on clinic. So I just started my clinic rotation today on Monday. So my schedule is pretty light as of today. From 8:30 to noon, I saw my patients in clinic. I have my own panel of patients that I see every like 6 to 12 months, sometimes as close as like every 6 weeks, depending on like the acuity of their medical conditions and how often they need follow-up. And from 8:30 to noon, I saw patients in clinic, and I saw about like 6 patients. And I think those patients are really special because I've seen them for the past 3 years. So I have a little bit of a relationship with them. I'm able to like joke around with them, ask them how their family's doing. I know, what's going on in their lives. in addition to just like, checking the blood work, talking about, what medications they're on. So those relationships are really special. And after clinic today, I had some like administrative time. So I had some time to like follow up on lab results, like call patients back to discuss, any changes in medications we were making off the lab results. And then I was working on some research this evening that I've been doing to kind of prepare for my fellowship applications. So the research, it kind of varies. Before this, I was working um, in the wards as something called senior role, which is where I help some of the interns just doing admissions for patients who are admitted to the hospital. So there's a lot of opportunity for kind of teaching, and if you enjoy like being a teacher and a mentor to younger people, there's a lot of opportunity for that in medicine, especially if you're working with like other residents or working at like an academic institution where they're medical students. So I was able to do that over the last 2 weeks, and today I'm starting clinic. But the schedule varies quite a bit, and I will say as a resident, you are working like a lot of days and long hours, but that definitely gets better when you graduate and when you become an attending. So there is a light at the end of the tunnel.
I see that we have questions in the chat. We'll get to those at the end of our structured discussion. And so the next question, I know that being a doctor is both mentally and physically taxing. So how do you maintain a healthy work-life balance?
Yeah, that's a great question. I think it's something that I'm still trying to like grapple with and trying to figure out. In terms of maintaining a balance, I mean, it's definitely very helpful that I'm doing my residency in New York City because I'm close, I live fairly close to my family, my friends. So just making sure that you're making time for people that are important to you. I'm living in Long Island City, so I'm one stop away from Jackson Heights where my parents live. So it's nice to be able to like visit them whenever I can. I think doing things that I enjoy, like making sure to do things like cooking, which I really enjoy, and making time for that is important. And then also I think like being able to say like no to things. Sometimes when you're working a lot and you've had like a really draining day, I think it's okay to say no to, certain like social engagements or things just to like prioritize, your wellness, getting sleep. So I think that's an important part of it as well. But I think I don't think that's really something that you figure out right away. It's something that you have to grapple with every step of the way.
Thank you. And then our final section will be advice for any prospective pre-med students. And so the first question is, what academic courses or extracurricular activities would you recommend to pre-med students?
Yeah, that's a great question. I think when you're in pre-medicine, like applying to like medical school or PA school, it is important to have like a little bit of like clinical exposure to have like some experience working with like a physician or PA, or like I've told some people to like try being an EMT, which is an like EMS service, which I know most colleges have something that you can enroll in, just to like kind of show that you've had some clinical background or some background where you've like seen what it's like to interact with patients. But at the end of the day, I think when you apply to medical school, in addition to that, it's pretty broad, like in terms of what experiences they think are interesting. So as long as you follow whatever you're interested in, I think as long as you show that you're like passionate about what you're doing, I don't think there's like one set formula. So just keeping an open mind, doing whatever interests you, I think is valuable, because when you're, interviewing for medical school, people will ask you to talk about the experiences. And I think a lot of times when you're at an interview, you can tell whether or not, someone's really interested or really passionate about what they're doing, or if they're not. So I would say like one, having some sort of like clinical exposure, whether it's like shadowing, working as an EMT. I think two, having, something that you're passionate about that you can like talk about during interviews. And then I think three, trying to have a little bit of like research also helps. It doesn't have to be in something that is directly related to medicine. For example, when I was in college, I did research on like this pediatric like social cognition lab. So the lab was all about like how children form memories and how that differs based on like what culture you're a part of. So it's very niche. It's not necessarily related to medicine, but it's something that I was interested in. And just showing that you have the ability to do some sort of research can also be really helpful when you're applying to medical school or yeah. So I would say those are kind of three things that I would in terms of advice.
Okay, great. So that about wraps up our structured Q&A. And so now I'm going to open it to any audience members who want to ask Yiga a question. I know that we have a couple in the chat. We can start off with Rungdal. Feel free to unmute yourselves and ask the question to Yiga directly if you'd like. But if not, I can read it off the screen. No worries.
Hello, everybody. Hi from Bangui. It's midnight here, but I'm happy to be in this call. And I don't think I've ever asked you this, Yiga, but if you could go back, let's say you could speak to 18-year-old you graduating high school, would you, and impart on that 18-year-old version of you everything that you know now? Do you think you would still pursue medicine? So if yes, why? And if no, why not?
Yeah, that's a really good question. I think I would, yes, definitely still pursue medicine. I think as someone in college, like because I didn't necessarily have like connections in the medical field or know any like doctors, anyone else working. I think nowadays there's like a lot more Tibetans in healthcare. I didn't necessarily know what the process required and what the training required, and I think it is important to kind of know that up front. After graduating from college, you have to go through like 4 years of medical school. You do residency, which can be anywhere from like 3 to 6 years, depending on your specialty. And then a lot of times after residency, you can, specialize even further and do something called a fellowship, which can be anywhere from like a couple of years. So I think as it's kind of surreal when you're in high school and you're kind of deciding on your career path, I think regardless of like what field you're going into, because you don't quite know, exactly what that career path will entail. And I think as an 18-year-old or someone who was a freshman in college who was interested in medicine, I didn't know exactly how long the path would be and how much you would require in terms of like commitment, time, spending a lot of your 20s in school and in training. But at the end of the day, I think I still would definitely pursue a career in medicine. I think it's such a valuable position to be in, to be someone's doctor, working in the inpatient setting, working in the ICU, being there for someone during like kind of the hardest time that their family is experiencing, and being the person who's there to console them, to like explain what's going on, as well as kind of the more like cognitive aspects of medicine, which involves being up to date. I think medicine is one of those fields where things are always changing. There's always research coming out. There's always new ways of optimizing treatment. So being someone who's like constantly learning is also like a really great thing, I think. And I think I really enjoy like the teamwork aspect of medicine as well. Like I work on a team with an attending, with my intern, with co-residents, and just like learning from each other has been great. So I think there are lots of aspects of medicine that I really enjoy, that I value, and I definitely would choose medicine. But I think as an 18-year-old, I didn't necessarily realize like how long the path would be and how much it would require.
Okay, great. I think Dory asked what do residency and fellowship mean. I think you touched on that a bit in your answer. So Dory, if you want a more extended response, I mean. Okay.
Yeah, I mean, I think so. In particular, I'm doing internal medicine, which is a pretty like general specialty. So after internal medicine, you can actually graduate and start practicing. as an internist, you kind of have a more like broad perspective on all the different organ systems. So you can, after graduating from internal medicine residency, you can work as like a primary care doctor. So kind of the doctor you see every year to every 6 months just for annual checkup, or you can work as a hospitalist, which are the doctors who take care of you when you're admitted to the hospital. On top of that, after completing internal medicine residency, you can specialize and do fellowship in like a specific organ system. For example, you could do like cardiology, you could do gastroenterology, you could do like pulmonary critical care, nephrology, which is like the kidney specialist. So I think there's a lot of scope, but there's a lot of different types of residency. And I think regardless of like your personality type or, what kind of lifestyle you want, there's a lot to choose from if you do decide to go into medicine.
Okay, cool. Ingsel Namgyal, if you want to read your question out loud.
Okay, sure. My question was like, I'm trying to gain like clinical hours and experiences, but a lot of like hospitals and clinics already like require prior experience. So I'm just asking like, what would be a good way to start off? Like, I know you mentioned like EMT and stuff like that, but like if you can elaborate more or if there are different options, that'd be cool.
Yeah, absolutely. Yeah, I think that's one of like kind of the challenges of gaining that initial clinical experience. Especially as like a first generation like Tibetan American, I found that it was really hard to I think a lot of my peers in medical school had family members or parents who were also doctors, so it was kind of easy for them to get their foot in. So what I did was kind of using the alumni network of my college. My school in particular had like opportunities for people who had also gone to Cornell to like kind of look through their alumni network to see like who was like a physician who was in the area. So just reaching out to them and kind of explaining your background, explaining that you're interested in medicine, but you want to get some like shadowing or clinical experience and do that networking. I think a lot of schools also have kind of like more structured programs where you can get that experience. So just being in the know about what opportunities exist in your college is really helpful. So I think I would start off with that. There are also a lot of opportunities to like volunteer at hospitals. And I think in those cases, it's a little bit of like a little bit of a crapshoot in terms of just like emailing different volunteering organizations and looking through like the hospital website to see what the email is for like the volunteering organization and saying that you're interested in volunteering. So in those volunteering opportunities, like a lot of times you have opportunities to kind of interact with patients and see what the hospital setting is like. So I think that is also really valuable, but I think it's definitely a challenge and it's not always easy.
Okay, and then Tenzin.
Oh, do you want me to ask my question? Okay.
Yeah, if you want.
I was wondering how many gap years you took. You mentioned teaching, but could you just expand on that, how you got to that opportunity, how that kind of helped you with applying to medical school? And then also, I didn't write this, but did you apply, like when you applied, was that your first time applying and you got in, or was that like a second cycle that you did, or yeah?
Yeah, that's a great question, Salah. I think I was a little bit unconventional in that I actually took 3 gap years. So in my gap year, after graduating, I did a program called Teach for America, which is an organization that allows you to basically get a master's in education as well as like teaching in an underserved community. So I did that for 2 years. I worked in a charter school in East Harlem, teaching like 5th grade special education. And that's something that I was like interested in. I knew I wanted to take a little bit of time off between college and medical school and take a little bit of a break. But it was a really like challenging, but also very rewarding experience. And I knew that I was always interested in like education and, kind of like disparities in education. So I think that was a good way of like tying my interest in that with my postgrad experience. And after Teach for America, I actually worked as a medical scribe at an emergency department. So a medical scribe is basically someone who documents notes for a physician. And I worked it was a job opportunity I kind of found just by like Googling it. And I felt like it was a good way to get some exposure to what it was like working in a clinical setting. I worked in like a fast-paced like emergency department, and oftentimes you like go with the physician to like see the patient, take notes on like what they're doing and document for them. So I think it helped a lot just in terms of like learning the vocabulary of like what it means, like how to like document medical things, how to like present cases, and also kind of like how physicians like made their decisions. So I think that was a really good experience as well. And it's something that you can do even in like college, because I think a few of my colleagues had been in college or had done it like part-time before doing it as a gap year position. So that was also a good experience. And yeah, and then after that, I finally was ready. I felt like I was ready to apply. And it was my first time applying, but I applied very broadly. So I applied in particular like all over like the Northeast region. I was hoping to stay in New York because that's where my family is. And luckily I got a spot at Sinai. And I think my experiences like undergrad, postgrad, like really helped me get that position as well. So I think those experiences can be really valuable if you kind of feel like you're not 100% ready, after graduating from college, or if you want to take a little break before going to medical school.
This is also some very valuable advice. If anyone else in the audience has any other questions, feel free to just unmute yourselves and ask.
All right, I have one more question. You mentioned that you were working with an intern. So were they like a pre-medical intern, or were they like already a medical student? And or like, do you know how they got that opportunity?
Yeah. Oh, sorry. So I should clarify, like in basically once you start residency, the first year is called like your intern year. So when you're working with like interns, you're referring to like the first year residents. In particular, like in the inpatient setting, so most of my job is like working inside the hospital itself, where I like work with and treat patients who are admitted into a hospital. And I think in those settings, you don't usually see people who are like not in medical school or not in the medical setting already, just because the patients are like more acute, they're a lot sicker, there's more going on. I think it's a lot easier to get opportunities kind of like interning or shadowing in the more clinic setting. So if there's anyone that you can reach out to who's in your network, who works in a more like clinic-based practice, for example, like the pediatric neurologist I was able to shadow when I was in college. He had like a clinic that he went to every Monday, Wednesday, Friday. So I think in those opportunities, it's a lot easier to work directly with doctors and to shadow them and see what they do day to day. When you're working in the hospital itself, at least at Mount Sinai, I have seen some like patient volunteers. And basically what they do is for patients who are in a lot of distress or who are like lonely, especially in the pediatric setting, they'll go do things like read to the patients, play with them, paint with them. So those are some opportunities to kind of just get exposure to the hospital setting and get some kind of like experience working in a hospital. But that's what, I should clarify, that's what I meant when I worked with interns.
Okay, thank you.
Yep.
Are there any other questions from the audience? I had a question. I'm not pre-med, but you mentioned that taking a couple of gap years is unconventional. I know that it worked out for you, but are there any downsides to taking gap years and not going to med school directly after undergrad?
Yeah, I mean, I think that's something to consider. It's not that unconventional because I think actually most of my classmates like had taken a year or two off. I think I was like, I took 3 years off, which is a little more unconventional. But I think a lot of people like just take time because like once you're in medical school, that's like 4 years of your life that you're spending more in schooling. So I think it is really valuable to get some kind of real world like experience working, you know, interacting with colleagues, being in a work setting, being able to be like a good coworker. Having that experience before going to medical school is valuable just because once you finish medical school and you're a resident, you're thrust into like a lot more intense of a setting where you're, you know, dealing with patients who are very sick, you know, having to manage like, you know, decisions, things where people, it's like a life or death circumstance, and that can be like really stressful if you haven't had much real world experience before then. So I think for me, it was really valuable. I think the only downside is that the training process is pretty long. So, like for example, since I'm finishing up my 3 years of residency, after that fellowship is like another 3 years. So by the time I'm practicing, I'm going to be like in my mid-30s. So I think just taking that into account helps as well. But having a year or two off, I think it's pretty conventional nowadays for most people. And I think it definitely helps both strengthen up your application, but also like helps you become a better doctor.
And then Dory asked in the chat if internal medicine is your specialization.
Yeah, so internal medicine is like the residency that I completed, but you can specialize in something after internal medicine. I mean, a few of my colleagues are going to be working as like hospitalists, which is what I'm doing actually next year. Which is when you just take care of people who are admitted, for example, if they have like a really severe pneumonia or if they have, you know, like cancer or something and you're managing the side effects and they need to be in the hospital. So you take care of them in the hospital. But after internal medicine residency, you can specialize in like a specific organ system. So there is the opportunity to do that as well. And there are a lot of different medical specialties other than internal medicine. You know, there's surgery, there's anesthesia, there's dermatology. So I think there's radiology. So depending on your personality type, like what you like, what you want your like day-to-day to look like, I think there's a lot of variation in what you can pursue.
Thank you, Yiga. So if anyone has any other questions, if not, we can conclude our first career chat of our series. We hope that you were all able to gain some valuable insight on the healthcare industry and the pre-med journey, and hopefully you all feel a little bit more confident about your career path. So yeah, I mean, please stay tuned for the next couple of weeks. We're going to be announcing some of our more career chat series, which will include professionals in industries like tech, business, law, etc. And so thank you all for coming. And Lodoe Yiga just mentioned in the chat, please feel free to reach out at her email. So yeah, thank you all for coming and I hope you have a nice day.
Take care,
Thank you so
everyone. And
much.
thank you to Rokpa and Daekyung for organizing this event.
Of course. Thank you, everyone.
Bye, everyone.
Thanks.